The U.S. has reached a new milestone in its fight against the coronavirus. The number of fully vaccinated Americans now tops the total number of cases confirmed in the U.S. As of early Monday, more than 60 million Americans have received at least one dose of a coronavirus vaccine. More than 31 million received both. And the CDC released its highly anticipated guidance for fully vaccinated Americans. It allows maskless gatherings for some, but still recommends adherence to public health measures under certain circumstances. All of this comes as states continue to loosen restrictions, fueling concerns of a spring surge. Cases in the U.S. have topped 29 million, and the death toll now stands at more than 525,000. Manuel Bojorquez begins our coverage in Fort Lauderdale, Florida.
Tonight, a shot of optimism from the CDC, guidance that all of those who are fully vaccinated have been waiting for. They can now gather with other fully vaccinated people indoors without masks or social distancing, and visit unvaccinated people in a single household who are not considered to be high risk for COVID-19. But they are still urged to wear masks and social distance in public and to avoid travel.
I think it's important to realize as we're working through this that still over 90% of the population is not yet vaccinated, and that it's our responsibility to protect those who remain unvaccinated and remain vulnerable.
So beginning to open the door to some sense of normalcy for people, but definitely not swinging it wide open.
No, this is a first step. This should be a real incentive for people who are not vaccinated to get vaccinated.
More students will soon be heading back to the classroom. Nationwide, the number of students attending virtual-only schools has now dropped to less than 24%. Those attending traditional in-person classes is getting closer to 50%. That will soon include high schools in the nation's largest school district.
We have all the pieces we need to bring high school back and bring it back strong.
Nationwide, Wyoming became the latest state to announce it will rescind its mask mandate, the order taking effect next week. Wyoming will now join 15 other states with no rules requiring masks.
Hurry up before the cops show up.
Idaho never had one, but a protest over COVID restrictions saw some bringing their children to burn masks.
Destroy them!
In Boulder, Colorado, this out-of-control party featured few masks and lots of damage. In Daytona, Florida, hundreds of thousands are expected to gather for an annual bike week, on top of the spring breakers already descending on Fort Lauderdale.
Some people look at Florida and think, oh God, here we go with another super spreader event.
Last year at this time when we closed the beaches down, it was because we were told that was going to be the super spreader event. It never was.
And as more shots go into arms nationwide, there was this find in a Monmouth University poll that 1 out of every 4 people remains unwilling to get it. Elaine?
Manuel Bojorquez, thank you. Dr. Teresa Amato joins me now. She's the Director of Emergency Medicine at Long Island Jewish Forest Hills. Dr. Amato, welcome. The CDC is now outlining safe practices for people who have been fully vaccinated. This is a positive development, of course, but these guidelines also suggest that we are not out of the woods yet. What do we need to keep in mind as we move into warmer months and into more states easing restrictions?
Well, I just want to say when the CDC came out with their guidelines today, I think that was the brightest light at the end of the tunnel that we've had in a year, quite frankly. So some really good news for people who are very fortunate to be vaccinated and have other family members that are vaccinated, that it seems that it's now safe that you can socialize without your mask on. And that's such great news, and we're really very excited by that. But the full story is that, we can't say for sure that that's a safe practice when you're outside of your little your home group or the group that you are fully vaccinated with. So if you're going to be around people that are not fully vaccinated or have not been vaccinated, or you're around a group of people that are not in your inner circle, that you're really going to have to keep your mask on for a bit longer until we can get to the herd immunity, which is going to be somewhere around 75 to 90% of people either having antibodies or having the vaccine against COVID. So not out of the woods yet, but an awful step closer to the end of this marathon.
So this Sunday on Face the Nation, former FDA Commissioner Dr. Scott Gottlieb said variants may cause an uptick in infections, but he does not believe they will cause a spring surge. Do you agree, doctor, or is there still a risk of another surge?
So there's always going to be a risk of another surge, and I don't think it's going to have to do so much with the variants. It will be about behavior. So every time the virus gets transmitted, it's got another chance to change its makeup. So we do know these variants are going to happen if we continue to spread the virus. So really, it's the behavior that we're looking at to keep this spread from happening. We do know that people do try to congregate as the weather gets warmer. So outdoors seems to be a lot safer than indoors. So that's one step you can take, trying to keep 6 feet apart if you can. We know that would help. If you're going to be indoors, to put a mask on and to avoid large crowds until we hit that herd immunity.
Well, what does the COVID crisis look like on the front lines right now, doctor? What are hospitals like yours still facing?
So it's a very interesting time because we're coming up on the 1-year anniversary of the first patients we saw with COVID. And I would say the mood, if you will, amongst the staff is much more positive than it was last year. I think it's a couple of reasons. I think we know so much more now than we knew then. We know that the PPE does work and we feel safer wearing it. We have treatments now that we know actually will help in the monoclonal antibodies early on in the infection to prevent ICU and death from COVID. We know that the remdesivir and the dexamethasone are good treatments for hospitalized patients, again, to keep them out of the ICU or to have a worse outcome. So it feels hopeful about treatments. And honestly, the vaccines has been a game changer for people's morale, really feeling now that we are getting to the end of this very terrible and long journey. So I would say the mood is cautiously optimistic at this point.
Well, a White House advisor says that despite the administration's efforts to achieve vaccine equity, the vaccination rates are still significantly lower in minority communities. I wonder, doctor, why is that? And what more can be done to improve that?
So, when you think about vaccines, you need three things. You need the supply of the vaccines, you need access to get to the vaccines, and then you have to have an acceptance of wanting the vaccine. So I think for some minorities, this is really tough. We want to get the supply to the places it needs to be, and then we need to get people to be able to get to it, right? So if you're relying purely on, let's say, public transportation to get to a site, and a site's in a place that doesn't have public transportation, and it may be something you can't afford to take an Uber or have someone drive you there. We look at our older adults. If they're not able to be savvy on the computers to get these online appointments, they won't be able to have access to the vaccine. And then, quite frankly, being accepting of the vaccine as being safe and effective. We can understand in people of color who have had, many slights against them previously from healthcare, including, unethical studies. I can't say that I blame them for being worried about it or anxious about it. So it's really important that our healthcare workers that are of those communities really get the word out and make people feel comfortable and safe getting this. I know for myself, I don't pass judgment. I just keep trying to educate and understand why people have hesitancy so that we can help them understand why it is safe and effective and is going to be what gets us out of this crisis.
All right, Dr. Teresa Amato. Doctor, thank you very much.
Thank you.